Hello, my name is Sariming Rivera. I'm a nutritionist with the WIC program at Skagit Community Action Agency. Do you know how important it is to take care of your baby's gums and teeth? Children need healthy teeth. Healthy teeth help them to chew their food completely and to speak clearly. Baby teeth also make the space needed for adults' teeth and give the face its shape. We need to pay attention to our baby's smile because they cannot take care of their teeth by themselves. There are 3 basic steps to giving your baby a beautiful smile. Your baby needs you to brush his teeth and clean his gums every day in order to prevent decay. This care should begin even before the baby teeth arrive. After every feeding, rub your baby's gums gently with a clean, damp washcloth. Usually, a baby's first teeth will appear around the age of 6 months. When they come, begin brushing the teeth with a smear of toothpaste for 2 minutes twice a day. Brush the front and back of your baby's teeth, then brush the tongue. Finally, lift his lips and brush at the gum line. Make sure to use a toothbrush with soft bristles and small head made for babies. Healthy teeth should be all one color, so check them often to make sure they are healthy. Lift your baby's lips to get a good look at all the teeth. If you see white or brown spots on the teeth, which indicate decay, take your child to the dentist.
Cavities are cavitations that have invaded the inside of the tooth. Why does that happen? Well, the reason why is because we have a film of bacteria that is not being removed on a daily basis. We want to remove that film. We want to reduce the amount of bacteria or germs in the mouth to a level that is not going to be conducive to creating cavities, cavitations, weak enamel of the tooth surface.
The best food your baby can eat is breast milk. Breast milk contains all the nutrients your baby needs to grow and develop, including the vitamins that will make their teeth strong. Take advantage of the superfood by breastfeeding your baby for at least 6 months to a year and even more. When you start introducing your baby to a solid food and juice at 6 months, do not give them junk food or lots of sugar. Tooth decay is caused by germs in the mouth that feed on the sugar left behind by food and drinks. These germs cause dental plaque, cavities, and decay. Babies who are given bottles filled with liquids other than water several times a day are at risk for a problem known as baby bottle tooth decay. Decayed teeth look bad, cause pain, and cost lots of money to fill. Give your baby a clean pacifier or wet towel to chew on instead. And at 6 months, teach your baby to drink from a cup instead of a bottle.
As a general recommendation, we like to see kids stop the bottle if they're using it around age 1. It's not the bottle that causes baby bottle tooth decay or cavities, but it's what is put in the bottle generally. We see kids that unfortunately get put to bed with a bottle with juice in it, and anything that's put in the bottle with sugar in it is going to cause cavities. So instead of those types of snacks that might cause cavities, it's a good idea to have fresh fruits and vegetables or cheese. And it's very important that kids, instead of having juice in between meals, just have water. Water is great because it helps to cleanse the teeth, and it also doesn't have any sugar in it, which is going to cause cavities.
The WIC program at Community Action helps to ensure that parents have the resources they need to feed their children healthy foods. Families that qualify for the WIC receive monthly checks they can use to buy nutritious food at the local supermarkets. They also receive nutrition consultations, health education, and breastfeeding support. You can participate in WIC if you are a pregnant or postpartum mother, or if you are caring for a child 5 or under, and you have a family income that fits WIC requirements. You can call the WIC program at 416-7595 to find out if you qualify and schedule an appointment. Going to the dentist is an important part of good oral hygiene. So ask your dentist when to bring your baby in for his or her first visit. It is recommended that you take your baby to the dentist at least one time before he is 1 year old to have his teeth and gums checked.
It's recommended that really children should be coming to their dentist usually the first year of life. You know, when the first tooth comes out, which is usually 6 months, maybe between 6 and a year. I recommend strongly that they actually come in at 6 months, because even if they don't have any teeth, this is a perfect time to start educating and sharing some information with the parents so that we can prepare ourselves on how we can take care of those teeth when they do erupt.
To prevent decay, you should also check your baby's gums and teeth at least once a month. Look for white spots and other signs of decay, such as mouth pain and red gums. If you see any of these symptoms, take your baby to the dentist right away. The dentist will help you clean your baby's teeth and may have recommendations for improving your infant oral hygiene, such as using fluoride supplementation. Take any question you have about your baby's mouth to your dentist.
You know, it's too late. When they bring them in with baby bottle tooth decay, it's too late. It's hard to have to repair that kind of stuff. You know, it's difficult, it's painful. So I've gone to the other extreme now. I say now we need to put more effort on the prevention aspect. And again, it's not that difficult to really understand, except it's just a matter of maybe understanding and maybe changing our habits a little bit that will go a long way in preventing this cavity.
Okay, let's review what we have learned. Having good oral hygiene is vital to the healthy development of your baby. You can make sure your baby's teeth are healthy by cleaning your baby's teeth, feeding your baby nutritious food, and taking your baby to the dentist. We hope you find this information helpful, and we look forward to seeing your baby smile.